Hi everyone, I am Dr. Vaishali Sharma, consultant gynaecologist, laparoscopic surgeon and infertility specialist. Today we are going to talk about do's and don'ts in the first month of pregnancy. As we all know, motherhood is divinity and pregnancy is the most important part of anybody's lifetime. So we should be aware when we are trying for a pregnancy, what can we do and what should not be done to avoid any mishap. So, as you all are aware, whenever you start trying for a pregnancy, there can be risk of bleeding or spotting or any other complication which can arise if you don't take proper care. The most important thing that you have to be aware about is if you are trying for a pregnancy, always stop doing any exertional exercise after the mid-cycle of the month whenever you have started trying. So, because the implantation is occurring in that time duration, and you will be aware about the pregnancy, you will get to know about the pregnancy only once you miss your period. But by that time, implantation has already occurred. And if something is mishap or something wrong occurs at that time, if you don't take proper care at that time, then you may have a spotting or bleeding immediately after you find out that you are pregnant. Another most important thing is avoid exertion. Avoid doing heavy exercises if you're going to gym. Avoid lifting heavy weights if you're going to gym. Another thing that you should take care during the first trimester is that you should take ample amount of water, because if you're not taking that good amount of water, you will be prone to have urine infection. Sometimes urine infection can have clinical picture if it is actually quite severe, but many times you may not be having major symptoms of the urine infection. And in that scenario, it is called as subclinical urine infection, which can again predispose you for miscarriage. Similarly, there are other things which you should not be doing in the first month of the pregnancy. That is, never take any medicine or any supplement without consulting your doctor, because there are certain medicines and certain chemicals which have to be avoided, because baby's organs are getting formed at this time. And in case you will take anything which is not advisable, or in fact which is contraindicated during this time period, then in that case it can lead to defect in the formation of the baby's body organs. Another most important thing that you should be doing is always consult a gynecologist nearby you, so that you get to know what is the location of the pregnancy. Many times people, they do urine pregnancy test at home, and then they just get to know that their pregnancy is there, but they don't consult any nearby doctor, or they don't get any ultrasound done, thinking that we will go and we will do it in the second month. But it should not be like that, because we need to know where the exactly pregnancy has located, because there are certain chances that there can be a mishap called ectopic, where pregnancy lodges itself in the tube instead of the uterus. So to get to know about the location where the pregnancy has actually started is very important in the first month of the pregnancy. So always consult your nearby doctor, get an ultrasound done, so that you are assured, yeah, pregnancy is there and it is very correctly located. Another good thing about this is, when you get an ultrasound done, you get assured about the growth of the baby, because many a times there is a thing called delayed conception, when a baby is getting implanted but not at the regular time of the cycle. So in that, what happens, you will be going to a doctor later on in your pregnancy in the second or the third month, and you will be saying, I have been pregnant for last 2 months. But if the baby was conceived late, delayed, and the implantation was delayed, in that case baby's growth will be shown smaller than that you will be describing with your dates. So in that case, there is always a confusion which occurs. Many times people they get disheartened, and they get worried unnecessarily, because somebody will tell them your baby is smaller than what you are actually telling that you have been pregnant for. So that in that scenario also, this first month ultrasound actually helps, because it tells us the exact growth of the baby at that time, and it also helps us in monitoring the growth further. There are certain things that you should avoid eating, specifically if you have tried for a pregnancy or you have just found out that you are pregnant. most important thing is papaya, because many times if you happen to eat a raw papaya, it seems they contain a chemical which is actually an irritant for your uterus, and it can increase the chances of having uterine cramps and lead to miscarriage. Similarly, there are certain other things which are not good for the growth of the baby, like caffeine or Ajinomoto, especially used in Chinese foods. And I would also recommend avoid using any food which contains any kind of preservative or which is not freshly cooked, in case you get to have constipation or loose motion whatsoever. All these changes in your digestion can lead to increased chances of the miscarriage. So you should be very careful about what you are eating, and you should definitely, as we have already discussed, you should take ample amount of water. Also get yourself tested in case you are facing any difficulty in passing urine, or you are suspecting that your symptoms are matching urine infection, like burning while passing urine or increased frequency of urination. In that case, it is always advisable to get a urine test done, just to know what is the exact cause of your symptom, and in case there is any subclinical infection, we have to treat it at the earliest. Similarly, we have discussed what you should not be doing during the pregnancy: avoid exertion, avoid traveling for the first 3 months of the pregnancy, and avoid lifting heavy weights, avoid taking any medicine without consulting your doctor. So we have so far discussed majorly all the do's and don'ts that should be followed during the first month of the pregnancy. And in case you find that you have some other query, or you want to ask some other question to us, you can always leave your comments in the comment section box, and you can always connect to us through our website drvaishalisharma.com, or you can also subscribe to our channel so that you will keep on having a regular update about your pregnancy. Thank you. Take care.